Hello, and welcome to the show Beyond the Journal, where we discuss social media, digital education, and current controversies and issues in cancer and medicine in general. I'm Dr. Jack West, Associate Clinical Professor in Medical Oncology at the City of Hope Cancer Center in the Los Angeles area. I'm joined today by my co-host, Dr. Charu Agarwal, who's the Leslie M. Heisler Associate Professor of Lung Cancer Excellence at the University of Pennsylvania's Abramson Cancer Center in Philadelphia. Hey, Charu.
Hi, Jack. And today we have with us Dr. Matthew Katz, who's a radiation oncologist at Lowell, Massachusetts, and Manchester, New Hampshire. Welcome, Matt.
Thanks so much for having me. I'm really glad to be able to join you tonight.
Just great. Let's just start with a broad, 20,000 feet view of social media. You've been in social media like me for over a decade now. And over that time, the role of Twitter in the medical community has really evolved and essentially grown from, at the time that we were starting, a platform that just a small minority of early adopters were using, to now being a central platform that's widely used, and you've even studied it and published about it. So can you just start by talking about what you see as some of the key changes and perhaps leading advances that this has brought to the medical community?
Sure. I think it definitely has changed a great deal over the last several years. My initial interest, I think, with a lot of early adopters was as a physician learning more about what people were thinking about healthcare and specifically about cancer care. So it was very much, at least early on for me, something that I saw as a way to get insights from people with health issues and to learn from them. And so when I first got started on Twitter, it was probably around 2010, 2011. And that was really very much centered on being involved in conversations with multiple stakeholders. What I've seen and has developed specifically with what we've done in radiation oncology, to some degree, has been watching over the last several years this become more and more something that there are a lot of physicians that have adopted it, particularly for radiation oncology, probably a little bit behind oncology starting around 2016, 2017. So it has definitely become much more robust. It definitely seems like residency programs, a lot of other entities have really adopted use and started sharing a lot more information.
So, Matt, could you walk us through some of the advantages in your mind about social media and physicians being on social media? You've certainly leveraged the power in many meaningful ways, and I would love to hear about some of the ways that you think it's most useful.
Sure. I think, my interests have not really changed too much over time in terms of my main focus, which has been to learn how to be a better doctor offline. And that's mainly been by learning about people's experiences that they have that they may or may not share with me in the office. So learning from other colleagues, people who have been involved in some of the sort of disease-specific oriented discussions that happen online have been my main area of interest. What has changed for me is I've sort of gone back and forth between seeing it as something of value and wanting other people in oncology to also recognize it as something that has value. So it's been really going back and forth at different times between trying to participate in patient-centered communities and trying to encourage other physicians to participate in it, as well as other healthcare professionals. I think the enthusiasm is there now for healthcare professionals to be doing it. One of the questions I have is, are we still remaining patient-centered enough? And so my interest has been sort of back and forth. It's been a little different this past year, obviously, with the pandemic. But my interest has been skill building for us to be better listeners and to learn how to interact with people so that we can learn more And that's helpful for me. I'm not sure that that's where everyone's focus has been in terms of what their interests have been, which I think understandably often are reputation building, reputation management, making connections and networking, which also have value. For me, it has been of less value for what I want, but that is very specific to what each person is coming on social media to get out of it.
Well, I think that's interesting because I feel like social media is kind of like a social gathering. It's different. If you and I get together for a beer, we have a certain kind of conversation. And if two people join that, it's still usually around one table. But as more and more people join in, it's not just one conversation. It needs to become a bigger thing. And kind of as you allude to, people are seeking different things. You are coming to it from your own perspective. Some other people are trying to build their own visibility. And one of the other things I see as it grows is that, there's other people who it becomes just a PR channel in some ways. Institutions just want you to retweet their stuff, and some of it is almost like glad handing. And so with that, I'm wondering, are there things that I don't want to be the grumpy old man saying, back in the day, it was, back in 2012 in the land of, in the days of the giants, we were really, but social media changes as more and more people join it. And are there things that you think it's lost in the time as it's grown to be more ubiquitous?
I do. I think there's been a tendency, and part of this is understandable, for healthcare professionals to interact more with each other than what may have been the case when we were the minority and there were a lot of advocates and patients who were in the majority because they were already out there on social media, and there were not as many oncologists or nurses who were actually participating and engaging. And I think one of the issues has been, understandably, how do you talk to someone who's online? And there are concerns about, where is the line for me to be doing this professionally? And so that hesitancy, I think, makes it much easier for a lot of healthcare professionals to talk to each other. But then it sort of becomes like a digital water cooler, and it's really just an extension of what we do offline to some extent for certain of the things that we do. And I'm not sure if doing it publicly is in our best interest sometimes. So I would like to see if, it's one of the things I've hoped for is to find enough people who are looking to really engage with patients and learn how to improve things, to sort of build an ethical, patient-centered army of people that aren't really looking to do the glad handing so much as trying to find a way to make things work, particularly with all the misinformation that's out there right now. I think it would be of great value. It doesn't necessarily get you credit or followers, but my hope is that people will find it satisfying. So to me, that's sort of where my interest lies. It's something that, as a result, I haven't been as active online. I will say, made a lot of good connections because of social media, though, that have led to publications and things like that, that also have been a reason that I've been online less. So, it's in some ways exactly the reason that many people are on. It validates that it actually is of value. But I think the key is, what is your underlying purpose for being there? And then using it as a tool to achieve that purpose, not just being there because everyone else is.
So you were also really integral in studying outcomes with the use of social media, especially in the medical realm, oncology realm. You were one of the founding members and, integral in hosting Cosmo, which is basically a collaboration of for outcomes using social media and oncology. And this was a very nicely attended conference in April of this year. There were, physicians like yourself, but also patients and patient advocates. Tell us, what was the motivation behind it, and what have you learned, and what are the lessons that you want to implement in the future?
Sure. Thank you for asking. I think Cosmo has been a labor of love that has taken a while to develop. Credit goes to Don Dizon for making it happen, really. It is something that, because of the success at ASCO's annual meetings, we've had a lot of people who've been very engaged and interested in seeing how social media can potentially make oncology practice better. And we had a crossover, a lot of people, Diana Atai and others, who then started talking about having this as an organization or as a meeting. And Don was able to find a way to get it funded. And as a result, timed out well with the pandemic that we could do something digital and have a lot of live attendance. And it was really dynamic, I thought, in terms of who participated. And it was across a pretty broad spectrum that didn't include just oncologists. So I think, right now we're actually working on writing up some of what was discussed in that, both on professionalism in social media, diversity and equity and who's included and how, looking at patient experience and how we can potentially do better with that. And so these are all areas that I think there will be some discussion about that hopefully brought some people that already knew each other together, but it did seem to generate a lot of interest from others as well. I think, that dates back to some of the other interests we've had, and you can see a lot of other people publishing on this also. What are the outcomes that we want? I think we still need to define that. And so this is sort of an early step in that conversation where we just had a way to formalize it as a topic outside of, ASCO's annual meeting or another professional society.
You alluded in passing to the misinformation out there, and I've actually noticed on your timeline you're talking a lot about the vaccine hesitant or the vaccine resistant, and I think that's a really important issue. I think that, to me, I'm struck by how this seems to be somewhat analogous to complementary medicine, and the fact that not that there is no evidence-based complementary medicine, but a lot of the appeal of complementary medicine is not tethered to the strong evidence to support it. It has a big following without generally being that evidence-based. That isn't its leading feature. But at the same time, the COVID vaccine acceptance or resistance is something that affects essentially everyone in the public world, in a way that the concept of taking complementary medicine for cancer only tends to affect the people who are facing a cancer diagnosis. So it's really something that is just about everyone now has a vote on whether they accept evidence-based medicine or reject that in favor of a different belief system. And, what really concerns me is that what I think we're seeing is that many, many people have tons of access to the information that we think should convert them, but they're not. And so I just wonder if I'm a little disheartened by this, and I'd be interested in hearing from either both of you really about, is that disappointment, disheartening thinking process justified? I mean, is there a way to get out of this, or are people just steadfastly, aggressively defending ignorance here?
It's a great question. I don't know what your thoughts are, Charo.
Yeah, I think I would really love to hear about your thoughts first before I
Sure, no problem.
You're our guest.
Yes. Okay. So what I would say is this.
I can get Charu anytime. No.
Exactly.
So what I would say is this. This is why I like listening to patients, and why I think active listening is much more important than just trying to tell people the truth. I think if you look at some of the data on who people follow, in the political spectrum, let's just take as an example, the people that get the most followers are those at the extremes, not the people in the middle. And as much as we may believe in evidence-based medicine, it's not how communication works. And I think one of the problems is we're trained in trying to understand the evidence and relay it to people, particularly in a private one-on-one setting. We're not trained in public persuasion. And part of it is being willing to listen to people who disagree with you and understand the underlying emotions that may be driving them and avoiding turning them off. And at the same time, then trying to direct them in the right direction with motivation. And I think the reality is a lot of persuasion is emotion-based. And I don't know if we've studied the tools well enough, and facts don't work. So my concern is we're going to keep beating our heads against the wall with this and not try to find a way to listen to people as well as we could. One person who's done a superb job of this and has shared her experience is Grady Doctor. She's actually given examples in some threads of active listening to patients and understanding what their underlying fears and concerns are, to then validate aspects of why people may feel afraid, and then give them reasons why maybe they shouldn't feel afraid and maybe change what they do. So I think if we found more people willing to learn those kinds of skill sets and apply them, I don't know if it works online. Unfortunately, the data from online does suggest that false information spreads faster and goes deeper than true information. But if we're going to be here online, I think there's some role in our fiduciary responsibility to try to carve out a way to do it competently, to share the information. And that may mean we need to learn different skill sets on how to do it.
I think that's really a really nice way to think about it. And I would like to build upon this just a little bit, if I may. You talked about, really learning about the patient angle and, trying to understand their why. And yes, misinformation is prevalent online. But do you think that Twitter is a good platform to be able to really dive deeper into the whys? Have you tried other platforms like maybe Clubhouse or Twitter Spaces to have a more meaningful discussion beyond the 280 characters, or people muting you, or sending bots after you?
Good question. So yeah, I do think one of the problems with Twitter is it is very ephemeral, and because it's small in terms of what you can share, it's not ideal for lasting information. I think the best platform for that, at least that's one of the mainstream platforms, is probably Facebook. That has its own whole host of issues, but it is something that it is easier to find posts and go back and link to them, and often not see things just disappear because it's not a constant stream of short blips. I've tried to avoid that by using bookmarks to some degree if I have individual things I like. And I've used Twitter moments to try to thread things together for conversations that have been helpful for me. And then I can share those conversations later. So for example, and this is something that we're looking at potentially discussing in a paper. This is something that came up around cancer bells and cancer bells ringing and being upsetting to cancer patients. There have been a couple different times that's been discussed that has brought up some very interesting insights from people that have been in chemotherapy infusion units or in radiation departments, and how it influences their experience of their cancer care. And so I think that there are things like that that I've found helpful to try to keep hold of, and I can then share that Twitter-based discussion. It's not ideal. Another option that people don't do as much now is write blog posts, and then you can share those. People don't usually comment on them, so they don't get as much conversation. I haven't used Clubhouse. I'm not sure it's with the live conversation, if that's as durable. I think it's very authentic, but I'm not sure. This is where I think it really depends upon what you're coming online for and what best suits achieving your purpose. There may be some people that do better with Instagram or Pinterest. I've found that Twitter has been about my maximum that I can do in terms of time commitment. And even that I've cut back on. So I would love to find something that worked better. This is again where if you had a group of people that coordinated themselves, they could find ways to strategically work on different platforms and try to share similar messages that came from a repository that we had. So that's where, again, other things people haven't looked at or talked about as much as something like Reddit, where you can also share things. Each one of these has their own strengths. To me, it is helpful to go where the people are. So part of it is understanding who you're trying to reach and for which issue. I wish I knew what to say about the vaccination issue. I think it does affect everybody, and it is different in the circumstance of a communicable disease than for something non-communicable like cancer. So I think some of the dynamics and the concerns will differ in terms of how you approach it. I'm not sure how best to do it, but I do think that if we look at some of the data, there are people that are doing research and publishing on this. And if we find people that seem to be doing it well, we might want to study and understand it better on how they're actually getting people to change their minds. The bot issue is a big one. I tend to not have too many issues with it. The only thing I do actively in terms of trying to block or mute is when I see a new account follow me that has 8 numbers in a string as part of it. That's not a real person. As far as I'm concerned, it would take a little bit more time and effort to put an account together. So I block those as a default. And most of those usually have 600 people they're following and 10 followers. That's sort of the profile of one of these automated accounts. But otherwise, I don't mute people. I tend to not cause too many I tend not to make any sharp comments either, though. I like questions more than answers.
On the other hand, I think one of the other variables out there in terms of how people do social media is a lot of people in medicine really prefer to stay in their lane and just look down and talk about a study, but never comment about political or social issues. And now I have seen you have commented a lot about relatively hot button issues. I mean, vaccination is the interplay of something that's now politicized, but it's medical. It's not radiation oncology. And, I'm interested in whether you gave a moment of concern or whether you're just following your heart or whether anyone in your personal life or at your institution has said, it reflects on whoever when you do this. And are you worried about becoming a magnet for people who are, quite volatile or something like that? What do you think about this? And if some colleague at your institution or in radiation oncology asks you about what do you think about integrating your personal life and personal views versus using this as a platform for medicine and discussions about professional life?
Sure. Well, what I would say is I do feel that my responsibility in some circumstances extends beyond my expertise. What I usually do when I'm discussing social issues, for the most part, is keep it either patient-centered, that it's in the interest of someone else's health, or I honestly don't necessarily always come down on one side or the other. I have tried to point out, some data suggesting, yes, vaccination may be helpful, or, it is something to try to protect the best interest of others. And maybe the evidence isn't always there for masks as much as some people may advocate for it. But my job is to take care of people that are immunocompromised. And, with a communicable disease, part of the social contract is not just our rights, but our responsibilities. And I will cross that a little bit, but I do tend to probably not go out there as much as I've seen some physicians in terms of trying to attract more people to an increasingly polarized view. My biggest concern, and I've seen this, I think since, you and I have been doing this now, not quite a full decade an immersive way. But there are many people who I started out with that were similarly just figuring it out with me, that were much more persuasive, much more charismatic, and much more willing to state an opinion, that have hundreds of thousands of followers now. And often it ends up creating more stress and trouble, and I'm not sure that it's necessarily worth it. And so I've tried to avoid going too much one way or the other. I have patients that have different opinions on this. And honestly, for me, it's something that the vaccination issue, I had my hesitation starting out about it as well. Partly because when it was first coming out and being advocated, it was on the heels of hydroxychloroquine, and it was a new drug class in terms of mRNA vaccines. My experience, interestingly enough, was when I asked a question about looking into clinical trials, because I wasn't quite as certain about it. The number one group of people coming down on me were doctors. And so there wasn't an engagement of discussion as much as a sense that there was a fairly stiff resistance to engaging even a colleague who might have had some hesitation. And I wasn't stating it as a fact or as a strong opinion. But unfortunately, I think right now in our society, there's been a lot of polarization, and just an example of that. So I don't think that there's a specific reason that we shouldn't discuss it. I just think we need to be open to listening to each other and potentially changing our opinions. And that's hard. And people don't do that easily, particularly when they take a strong stance. And that's why I tend to be sort of not neutral, but I tend to be somewhat non-committal.
Well, it does take, I think, a lot of courage, or just a different mindset to be, Jen Gunter or Esther Chu, or, various physicians who have put their politics and their social beliefs out there in a way that has generated a lot of followers, and are thoughtful, but you are a magnet for both the fans and the detractors. It takes a thick skin to put yourself out there that way. And I think it's interesting the way you mentioned that the way that we are trained to talk in measured, circumspect language about the facts is not necessarily the way to win over the masses. That's, we've seen presidents who have been very illustrative that, being the most, coming up with the most thoughtful, evidence-based argument is not the way to win over tons of people. So I think your point is very well taken, that there are ways to communicate outside of academic medicine that are far more effective than the way we tend to try to work things.
Yeah, and I think, we still have to answer questions about how something as scalable as social media actually fits for physicians and other health professionals with what we do. Is what we do scalable online? When we're committed to helping individuals in a very personal way, usually, where we're dedicated to doing it in a private setting. And at the same time, this is very public. So I think we still have a lot that we have to figure out on how to be effective. But that public-private line is a difficult one.
So, Matt, I'd like to turn to another topic related, but a little bit different. You've published papers on this, the role of social media in education, and use of social media amongst residents in radiation oncology. And some of the conclusions have been that, hey, social media is great for educational content, but can also serve sort of as, a stressor almost, with the pressure of having to keep up and having to post and repost and retweet and having to, sort of create an online presence. When you discuss this with trainees and, they ask you, how do you manage this, or how should I use social media? What kind of advice do you give them? We have a lot of trainees listening to this podcast, so I'm sure they would appreciate your expert input.
Sure. Well, I do think, for radiation oncology, which is the group that I spend the most time with in terms of seeing what happens in my specialty, the amount of resident participation on Twitter has increased substantially. And a recent publication had suggested that it's gone up from about 25 residents involved in 2014 to about 300 some odd residents in 2020. And I do think that people have recognized that, I'm a private practice radiation oncologist. Why do I have so many followers? And maybe it's something that really will add some value for me to be able to pursue certain things in my career, share who I am. And it can, but I'm not sure what the answer is now that everyone is here. I think it creates a different dynamic when it's just a few of you and you find ways to interact. I think it's going to be a matter of trying to understand why you're here and how you're going to use it. So from my standpoint, as I've circled back to what has worked and what has not worked, my thought is essentially being online should be the opportunity to show the better angels of your nature. And there are certain things that, sure, getting emotional and showing certain aspects can help, and it can. But this is sort of a permanent record of who you are and gives a sense of how you may function in a different setting, even though it is digital. And I've also heard separately from not trainees or young attendings who are enthusiastic about this, but some more senior people that are not so enthusiastic about everybody using it, and sometimes get frustrated hearing that people who are training are actually looking at their cell phones instead of paying attention in clinic, and that the distraction element actually may detract from your actual learning process in real life when you have it. So I do think it's a great supplement and complement in ways that you can get information through an experience that maybe your institution doesn't have, and interact with people and get exposed to things that you wouldn't otherwise come across in just the place that you work. But I think if that is oversold, you miss out on really taking advantage of the people sitting right in front of you. So to me, that's the sort of the balancing act that I would recommend people try to find. And part of that is going to be what works and how much you actually can learn in the environment you're already in.
I think that's interesting that I think that one of the values, there are not many settings where there are many radiation oncologists in the same place to learn from. Many radiation oncologists practice in not isolation, but just limited exposure to other people's views and interpretations of the data. And in that sense, I think that having a global community of radiation oncologists to bounce ideas off of and interpret data together, I think is a real value. My sense is that many of our medical professional communities feel much more like a rich global community where we are talking with European colleagues and people in other institutions, whereas I definitely felt a sense of, well, that's just the way we do it here. About so many things that we do, things like stage 3A disease, where there's tons of interpretations, and yet there's an institutional culture and memory that is just, well, that's how you do it, because that's the way I was taught to do it. And I think there is a real value to being exposed to so many different institutions and geographies and overall individual perspectives from what is now a global community of colleagues.
Absolutely. And that is something that I have still found very valuable. And I do think that's been part of the reason that, we had developed a journal club when we sort of set out to do that in 2014. And that's had its ups and downs. But yes, that's been great because it's allowed me to learn things that I wouldn't, both from experts, but also it's brought up questions for real life problems and challenges that people have, whether it's in the Philippines or in Philadelphia, for how to take care of people that maybe I would not have thought of otherwise. And for me, you're right. I work in a community setting. And so most of the time I am either by myself or with one other radiation oncologist. So once you leave residency training, many oncologists may not have that deep network that they had during their training process. And I think it's been very valuable. It's a matter of trying to make sure you set limits on how you use it, so you use it constructively as a complement to what you otherwise are doing.
And speaking of journal clubs, have you found the format friendly on Twitter, or do you still think that there may be room for an audio component to really hear the voices and opinions regarding journal clubs? So how's your experience been overall with it?
Well, I think I'm coming from a different place than a traditional journal club to some extent, partly because of my involvement in chats and seeing the journal club as having a slightly different purpose than it does when you're in your fellowship or in your residency training setting. Most of the time when you're looking at a journal article and you're sitting around with everyone, it's partly learning to analyze it and sort of slice and dice it and find ways to critique it. And that can be of great value to try to learn to hone your critical thinking. Mm-hmm. When you're doing it in a public setting, my thought is you want to be able to probe and ask helpful questions, but it's also an opportunity to give some gratitude to the authors, particularly if they're participating in that journal club, so that they have a chance to get some recognition for their work. Doesn't mean you have to fawn over anyone, but it does mean the purpose is partly disseminating information. And it's why I like interacting with people that are non-physicians. It gives me an opportunity to share this, hopefully in a way that then can be translated into plain language and be meaningful to people. And that also is something that I would think many people publishing papers may not get the direct feedback from people who look at this with a non-medical perspective. And I think sometimes that's helpful for the authors and the participants as well.
Can I ask about tweet chats? I know that the format of the journal clubs has often or always been a tweet chat. You've also participated in a bunch of others. I know you do healthcare leader chat and things like that. I have trouble with it. I've done a lot, but I think that the rapid fire format and trying to fit complex thoughts into an edited 280 character phrase is a challenge. And it's hard also to get people all together in this compressed time frame. So, I mean, if you have a live clubhouse talk, at least you have a format that's more conducive to the exchange of complex ideas without there being a limit in the number of characters you can utter. But so the tweet chat to me seems challenging. Just a difficult combination of ephemeral and limited in what you can convey, especially if you're trying to get nuanced ideas across. So obviously you've thought about it. You've mentioned that there's ups and downs to it. So I mean, maybe it's like democracy, and you say, well, it has its many flaws. It's just the best of everything that of what's out there. But maybe you can give your reflection of things that work, things that don't work about the tweet chat format and journal clubs.
Sure. Well, I think, it is something that, the original use of Twitter was sort of like a cocktail party. And it can be rapid fire. And It is something you're not going to see everyone's conversation, because in a busy conversation, there's no way to keep up with all of the different strings. And so there are elements that are dissatisfying. What I found, and this is what really got me motivated to do this for healthcare, was the BCSM or hashtag BCSM chat when that started in July of 2011. The reason being, I've had family members that have had breast cancer. It's been a focus of interest for me as one of the areas I treat a lot of patients. And the generosity and willingness of people to share their experiences has been of great value to me. And they can be hit or miss. And there can be times that are not always something that are conducive for me to join every time. And then I don't necessarily keep up with knowing everyone. But I can say that those have been the most meaningful chats to improving the quality of my patient care, much more than keeping up on articles. And it's been because there have been one or two comments here or there over the period of a month or two that I learned from someone's frustration or comments, a way to think of an experience that in the 15 minutes I have for a follow-up, when I see a patient, something clicks that maybe there's something relevant that I can ask as a question, because I actually heard someone express a fear or a frustration online that then actually helps me connect with that person better. So it's, periodic, but a good example from that chat is for breast cancer patients, particularly younger women who are finished with their radiation therapy, getting back into the swing of now having finished surgery, possibly chemotherapy and radiation with or without immunotherapy, and moving on sometimes to endocrine therapy. Healthier women will sometimes bounce back and be ready to do all their activities. They're still feeling some trauma. And at the same time, they're expected often to go back to feeling normal. And I've asked a good number of people how they're feeling about things, and many do feel that everyone is expecting that they're back to normal because they visibly look that way. Their hair has come back. They look still otherwise young and healthy, and they're likely to be cured, but it's been a scarring experience. And it leaves some women questioning, because they don't often talk to other people about it, sort of a feeling of a bit of medical gaslighting. Everyone is saying, I should be feeling better, should I, when I don't? And it is something that when I've mentioned that to people, it clicks. So I don't have a lot of just young breast cancer patients because I've got a diverse practice. But I would say probably in that 3 to 6 month period after radiation is over, that's when I've seen some women struggling with this in particular. And when I bring it up, it seems to resonate. So that's just one example, but that's why I do it.
Mm-hmm.
Well, this has been a great conversation, Matt. Thank you so much for joining us today. Incredibly insightful conversation about Twitter and your use and current thinking about how we can best utilize these platforms. You can find us on iTunes or wherever you find your podcast content. We hope that you will subscribe and send us comments and feedback to beyondthejournalshow@gmail.com. We would like to thank Mark Lindsay and Talking Speaker for production and distribution support. See you in a couple of weeks with our next guest. Thank you.
Thank you. Take care.
Thank you, Jack. Thank you, Charu.